You are at increased risk for heart attack or stroke if you have high cholesterol levels, high blood pressure, or if you smoke. The presence of any single risk factor doubles your risk. Having 2 of these risk factors quadruples the risk. And if you smoke, have high blood pressure, and have high blood cholesterol, your risk increases 8-fold. This certainly makes you think. This is the third in a series of 3 videos focusing on simple changes you can make to lower your cholesterol, your blood pressure, and help you quit smoking. Tip 1. Consider nicotine replacement drugs. Nicotine is the primary addictive substance in tobacco that makes quitting so hard. Cigarettes are designed to rapidly deliver nicotine to your brain, triggering its reward system and providing pleasure and euphoria. As nicotine stimulates parts of your brain over and over, your brain gets used to having nicotine around. Over time, nicotine changes how your brain functions and makes it seem like you need nicotine just to feel okay. When you stop smoking, your brain gets irritable. As a result, you might have difficulty concentrating, have strong urges to smoke, or feel generally uncomfortable. Nicotine replacement therapy works by replacing some of the nicotine you used to get from cigarettes, so you don't feel as uncomfortable after quitting. Nicotine patches and gums are the most common medicines for quitting smoking. Nicotine replacement therapy triples your chances of quitting from 2% to 6%. Step 2. Preparation is the key. Nicotine replacement therapy only handles the physical dependence. You'll need other methods to help with the psychological dependence. Tell your friends and family that you're trying to quit. They can encourage you to keep going, especially when tempted to light up. You should also avoid alcohol and other triggers. When you drink, it's harder to stick to your no-smoking goal. Likewise, if you often smoke when you drink coffee, switch to tea for a few weeks. If you usually smoke after meals, find something else to do, like walking, texting a friend, or chewing gum. Tip 3. Remember that time is on your side. You get immediate health benefits as soon as you quit. After only 20 minutes, your heart rate goes back to normal. Within a day, your sense of taste and smell will start improving. And in just 2 to 3 weeks, you will begin to lower your odds of having a heart attack, your lung function will improve, and you'll experience less coughing and shortness of breath. In the long run, you will also lower your lung cancer risk. And finally, try and try again. Quitting smoking is a process. Research suggests smokers make an average of 30 attempts before successfully quitting. Be patient with yourself and celebrate each small success along the way. Thank you for watching this video. Please watch my next video if you'd like to learn what happens inside your body when you smoke a cigarette.